Dear colleague, the case that at present today is a fetus that has multiple malformations, and that was in the third trimester, in particular, is at 30 weeks and 4 days of gestation. The examination, as usual, begins with a detailed study of the head. We observe several characteristics, such as the presence of a large cyst median. Does not observe the cavum on septum pellucidi, that is placed on suspicion of a genesis of the corpus callosum. For a moment we have observed that the cerebellum is reduced in size, and then check how many weeks match. One of the hallmarks of this fetus is the presence of this alteration of the profile. We observe two fundamental elements, micrognathia and, as you saw, a profile oblique. We return to the study of intracranial. We note, as mentioned previously, the presence of cysts in the median near the cavum of septum pellucidi. Biometric's brain is smaller than 7 weeks and configures the framework of a severe microcephaly. Another sign that we have encountered is the absence of hydrocephalus. You see the presence of edema around the theca externa, which measured about 7 millimeters. Now you see the atrium. Here, as we said before, you look at the cerebellum, which measures 21 millimeters, which is about 21 weeks, and then there are about 10 weeks of delay. The cisterna magna is wide for the hypoplasia of the cerebellum. As you visualize the proximal atrium, there is the absence of the cerebral convolutions. This is another important element that we discuss at the end. There isn't a cleft lip. Another sign that we have identified is the presence of an unimportant microphthalmia, and, as you see, there is a marked hypothyroidism. You see a measure of orbital diameter is about 24 weeks. Another element that we see is the presence of a cryptophthalmus, that there is a feeling of not seeing the eyelids. At this point we pass to the study of the heart, and here is amazing. It seems perfectly normal. Yet viewed as cardiac area, it's shifted to the left. The left lung is strongly hypoplastic compared to contralateral lung. The right lung is characterized by the presence near the site of a small pleural effusion. We study the abdomen, and we note the presence of a regular entry of the umbilical vein. But for the whole duration of the examination, which lasted over an hour, did not see the stomach, and then it's also the suspected esophageal atresia. Notice also the abdominal biometrics in extremely small compared gestational age. The spine is smooth, and smooth is also the urinary tract. Now you see the kidney and the contralateral kidney. We observe the profile again. And look at the micrognathia is evident, and as the sensation of lack of highlights is equally clear, and suspicion of cryptophthalmus. Let's study of the lower limbs. We observe another abnormal situation. Notice how even in this case, biometrics is lower than gestational age. Especially look at the attitude of the arts and the bilateral club foot. You look at the picture. Both femurs were paired. The image of the two paired legs. You see very well the bilateral club foot. Here you observe the presence of a small area of edema. Near the heel of the fetus. The fetus was so lancet we waited several minutes, but the attitude has always been of the lower limbs in hyperextension. Even the upper limb presents a biometrics declined, although less pronounced. Notice how accurately studied the hands. You watch the overlap. Now you observe this. That is the overlapping of the second and third finger. There is a significant increase in amniotic fluid, even within limbs. Notice how we keep coming on the legs to see any movement of the limbs, but the fetus has the legs always in hyperextension. Amniotic fluid is irregular. Return profile. We find once again the presence of a micrognathia. In conclusion, the first consideration is that there is a chromosomal change in appearance, and in particular seeing a fetus with malformations. The experience to make us think of trisomy 18. However, we must say that the presence of microcephaly, the presence of a growth retardation, the presence of a micrognathia, the presence of a slanted front, the presence of a cryptophthalmus, the absence of the corpus callosum, and the fixity of the limbs, the present edema in the vicinity of the head, abdomen, and articulations, makes us ask the suspicion of a genetic syndrome, and in particular for the specific case, we thought it was the Neu Laxova syndrome that, as you know, is autosomal recessive and providing genetic counseling of the case. Thank you for your attention.